Hello.
Merry Christmas.
Merry Christmas, day after.
Day after Christmas today.
Yeah.
Back at it, though.
I was almost going to say Happy New Year, but we'll do that next week.
We'll have to get that next week.
So.
Yes. Well, if you're joining us today, thank you very much. Hope you had a happy holiday here this past weekend. We are jumping back into laser therapy. And so this is the Laser Therapy Institute podcast. This is targeted at healthcare providers. If you're not a healthcare provider, you're still allowed to listen in.
Oh, definitely.
But we are going to be a little bit more technical potentially today. Next week we'll be doing an episode of Healing at the Speed of Light, and that is our more patient-friendly podcast. So that's a great one if you're a patient or if you're a healthcare provider looking to share information about laser therapy with your patients. Then certainly sharing the episodes of Healing at the Speed of Light is a good way to do that. What we do is we review research articles each week that are specifically about laser therapy and talk about how to either put that into practice for you as a healthcare provider, or if you're a patient, how to utilize that information if you are looking for care for a particular condition, how to make sure that you're getting good, excellent laser therapy care, and if laser therapy might work for your condition.
And there are a number, if they're not catching this live one or the live next week, they can certainly go to our website and search through the over 100 episodes we've got.
Yes.
So,
yeah,
really pretty exciting.
Yeah, it is pretty good. Yeah, you can find the podcast on Apple Podcasts, Google Podcasts, Pandora, Spotify, all of those things, of course. But like Christy just said, you can actually go to the website and you can search the episodes that way. So if you go to our website, lasertherapyinstitute.org, you can click on podcasts, and there's a search box. You can type in whatever kind of topic you're looking for, whether it's cervical spondylosis, like we're talking about today, or if it's everything else from neuropathy to rheumatoid arthritis to you name it. There's probably an episode on it.
And if not, you always said, give us ideas.
Yeah, exactly. Yeah, if we have not touched on something that you're interested in, send us an email and ask us to do it, because we really have a pretty flexible schedule as far as what type of research we cover. There's over 6,000 studies we can choose from out there to kind of review. So yes, send us an email, shoot us a note. You can catch us at info@lasertherapyinstitute.org. We'll be happy to look at your suggestion for podcast episodes. It's always good for us to be able to get into the research a little bit and see what the science is showing. And that's exactly what we're going to do today. So Christy is joining me today. Christy is a certified laser tech, and she is also the VP of Content Development here at Laser Therapy Institute, which means that she puts together all those awesome online courses that our providers get to have benefit from. She does all the technical side of that. And my name is Dr. Jason Roundtree. I'm a certified medical laser safety officer and a chiropractor, and we put together a lot of great content for training. So if you're a healthcare provider looking for training on laser therapy, you want to look and see what we've got, you can go to our website, again, lasertherapyinstitute.org, and see what is showing up on the offers page for you. There's a whole lot of different things that we can offer. We actually have a brand new course that we're about to launch on the spine. So if you're a spine-focused practitioner and you want to know more about using laser therapy for spinal conditions, that would be a great course for you. It comes with several different custom custom treatment settings for your laser. It comes with protocols, I think like almost 24 protocols for different spine conditions.
18,
thank you. See, she's the one that puts them together.
It's all his brains, but I make it viewable.
Yes, thankfully. Definitely check that out. But today you're here because we're talking about cervical spondylosis, and that would be neck arthritis for the little bit less technical form there. So the reason this is important is neck pain, not arthritis necessarily, but neck pain is the number 2 reason that people go to the doctor when it comes to musculoskeletal complaints. Do you know what number 1 is?
Low back?
Yes, you're exactly right. Low back pain is the number 1 reason people go to the doc for any kind of musculoskeletal complaint. Number 2 is neck pain. You know what number 3 is?
Knee?
Shoulder.
Shoulder.
Yes. Yeah. Knee is very close, but the shoulder is actually the number 3 cause of pain there. Yeah.
That makes sense. But then it all, anyway.
Yeah. No, there's a lot of things.
Connects together somehow.
It does all connect together, yes. And we know the neck can have effects on the shoulder. We know the neck can have effects on things like headache, and even into low back pain too. So it's good to go ahead and cover neck pain here. We're specifically talking about neck arthritic pain, so chronic neck pain. They say the estimated prevalence of chronic neck pain is about 10 to 24%, which is a pretty broad range, but that is a large selection of the population that at any one point is dealing with chronic long-term neck pain related to arthritic change and degeneration. Now, there's a lot of surgical options out there. We're not going to get into any of those today. There's way more non-surgical options, though, too, and they've been used for decades and decades. Everything from spinal manipulation to exercise to herbs, and there's all kinds of different things that can potentially help. We know at this point, really, exercise is going to be the number one most effective non-invasive treatment that can be done for most painful situations, and neck pain is really no different. Exercise is the most reliable, most beneficial type of treatment you can do for chronic neck pain and neck arthritis.
And again, you just have to do it right.
You have to do it right.
You have to make sure you have good direction, good influence, just like anything.
Yeah.
You can still do it wrong and cause more problems.
Yeah, for sure. Yeah, you can't just start slinging around weights and throwing medicine balls at the wall and things like that and think that it's going to help your neck pain. We're talking about specifically guided exercise here, physical therapy, guided exercises, or chiropractic, or whoever. And a lot of personal trainers can do a lot of good for people as well, so I don't want to undermine anybody there, but just to say that good, well-educated, guided exercise can be incredibly beneficial for so many different complaints. But a lot of people are afraid to do exercise, and a lot of people are limited by pain and how much they can do.
I was going to say the pain would inhibit some of that, though, because, it's the old adage, no pain, no gain, is not something to follow.
Yeah.
I mean, you have to push to your limit, but not beyond that, and it's not always going to be good if it's painful.
Yes, and especially with something like arthritis in the neck. You're talking about degenerated tissues. They are less resilient. They don't recover as well, and so pushing too hard with exercise absolutely can give you, kind of a spin in the other direction. So it's wise to use exercise correctly and have it guided, but it's also good to have other things to help out with pain.
Right.
So that's kind of what we're looking at today. We know exercise is good. We want to be able to magnify exercise's effects and also make it easier for patients to complete.
Right.
To get started, to follow through, and stay on, because exercise is really one of the best things that people can do when it comes to chronic pain and degenerative processes. Staying strong, staying active, engaging those different ranges of motion, that's all really beneficial.
Right.
I've got another couple of quotes here I want to read. I'm not even giving you the title of the study yet. I will in a minute, but
keeping people hanging.
Yes, I'm sure everybody's dying to know what the full title of this paper is.
No cheating by going to the notes.
It's a little long. So, they do say in the study that most mechanical neck pain is responsive to conservative care, conservative therapies. The optimal treatment has yet to be established, meaning that, what is the ideal mix, and then this is really still a lot of times up to the practitioner, whichever PT or chiropractor is really delivering some of this care. So there's not just a standard of care, other than to say that exercise therapy usually ranks kind of at the top. Now, in this case, we're talking about laser therapy, right? And in this study, they say that high-intensity laser therapy, which is high intensity, would be performed with a class 4 laser. And that is something that really acts the same as any other light source, but it can be more intense while completely safe, as long as you just got to wear a pair of glasses, but it can be completely safe. So they say that high-intensity laser therapy is supposed to have anti-inflammatory, analgesic, anti-edema, and reparative effects. The analgesic effect is based on a direct action on nerve structures, and its ability to slow the transmission of the pain stimulus and to increase the production of morphomimetic substances in the body. Moreover, high-intensity laser therapy acts altering the release of histamine and bradykinin from injured tissues and of substance P from the peripheral nociceptors, thus increasing the pain threshold. So, yes, slows the transmission of the pain signals, but also helps you to handle pain better. I'm sure we all know people who have very poor pain tolerance, and some people have way too much pain tolerance. And so, in many cases of chronic pain, if you're a practitioner who's worked with chronic pain before, you know that these folks can get extremely sensitive to almost anything and everything, to the point where they have pain when they really shouldn't. That threshold has dropped, and that is very, very common with chronic pain, that the threshold drops over time, and you become more and more sensitized to pain. It becomes that much harder to work through. So laser therapy actually helps to bring that threshold back up to close to where it should be, so that people can tolerate pain more appropriately, like they're supposed to.
Appropriately is a good word. So
because you don't want to ignore pain. Pain is a signal; it's an important signal. But if it's, if it's shouted through a megaphone rather than whispered, then it's too much. And so bringing that threshold back up to the correct place will help people feel better. Yes, help people with pain, but it also will help them tolerate exercise and activity better. They go on to say that pain is inhibited centrally as well by an increase in the secretion of endogenous opioids like beta-endorphin, and the reduction of inflammation by the stimulation of increased neutrophil and macrophage activity. Laser therapy decreases interleukin-1 and C-reactive protein and enhances lymphocyte response and superoxide dismutase levels, thus determining its anti-inflammatory response and its ability to accelerate tissue healing. So, we're slowing down the pain signals, we're increasing the pain threshold, but we're also stimulating repair directly and systemically as well through the effects on these different cell signalers. They say, according to recent research, laser therapy stimulates mitochondria with an active role in the cytochrome C oxidase, which is a multi-component membrane protein that creates ATP. This actually increases the ATP production and increases the proton gradient. This increases the sodium-calcium pump, antiporters, and all of the ATP-driven carriers for ions. The activation of second messengers is important for the activation of biological cascades responsible for cellular contraction, gene expressions, blood coagulation, etc. Several studies have shown that high-intensity laser was more effective than low-level laser therapy thanks to its ability to reach and stimulate the larger and deeper fascial areas. So that's how light works, right? That's your rundown on the function of light within the cells and how they work. So if somebody asks you how they work, now you know.
There you go.
You just got to repeat all that back to him.
He will give the name of the study, and you can go back and reference that at any time.
You're welcome to read that out. There's a lot more patient-friendly descriptions out there that you're going to want to get familiar with. If you're a healthcare provider, you don't really want to be talking to them about superoxide dismutase, generally. But this is good for you to know. Now, you need to know that there's actual science behind the way this works. It's not just fairy dust.
Exactly. No. And again, a good reference for our patient-focused podcast.
Yeah.
So you can get familiar with those as well.
Yeah, give it a little bit more patient-friendly on that side.
Yeah.
Now, the last statement I said is a little bit controversial. High-intensity laser versus low-level laser. Low-level laser is going to be your lasers below half a watt of power. Your high-intensity laser is lasers above half a watt of power. The thing is, you just expand that beam size on that more powerful laser, and the intensities are the same as the low-level laser, but you're getting more done more quickly. You're exposing more tissues to light. You can raise the intensity a lot as well on either a low-level laser or a high-intensity laser simply by raising power and shrinking the spot size. You're intensifying that. And what they're talking about here, reaching and stimulating larger and deeper fascial areas. The larger your spot size, the higher the power, the deeper you're going to be able to push that light. You need to get an effective dose to the level that you want to affect if that's what your goal is. If you want to get to a deep tissue, you need a large spot size, you need high power, because yes, wavelength is the most important factor, the right color of light, but you've got to have enough photons reaching that target tissue to affect it.
Right. Right.
So that's all we'll say about that, because it is a, like I said, controversial kind of topic, and just thought it was interesting to go ahead and read that off of here. So if you want to look this up, this study is titled Comparison of High-Intensity Laser Therapy and Combination of Ultrasound and TENS in Patients with Cervical Spondylosis, a randomized controlled trial. Published in Lasers Medical Science in November 2018. And this is really interesting because they took 84 patients with symptomatic cervical degenerative disease, cervical spondylosis, and they assigned them to either get exercise and laser therapy, or they got exercise and ultrasound and TENS altogether.
Okay.
So those were two different groups. The groups were completely indistinguishable as far as there was no differences in their pain levels, their age levels. They were all, very, very well randomized. And then, like I said, everybody got the same exercise protocols, and it's just half the people got laser therapy, and then the other half got ultrasound and TENS, but everybody did the exercise, right? So they treated both groups for 12 sessions, so twice a week for 6 weeks, and then they did a final follow-up 4 weeks after that, so a total of 10 weeks, 12 sessions spread out over the first 6 weeks, and then a 1 month kind of rest period, off period, and then they brought them back and evaluated them.
Anxious to hear the results.
Yes. I've got a bunch of different quotes that I'm pulling from the studies. I've got to flip to them here. So the outcome measures they used to measure this for everybody was cervical range of motion, pain levels on the VAS, the visual analog scale, and then functional activities, which was measured on the Net Disability Index, which is very, very, all that's very common, right? You always measure mobility, range of motion. You always want to know what pain levels are, 0 to 10. You always want to know what the disability is. This is stuff you'll do every day in clinic, So this is very clinically applicable as far as the outcomes that they decided to use. So again, everybody got exercise. For the exercise, the patients did 30-minute sessions with general stretching of the traps, the scalenes, the rhomboids, levator scap, the pecs, and suboccipital muscles. They did strengthening exercises, including active flexion of the upper cervical spine and extension of the lower cervical area. They were taught to do this at home as well, doing self-training with a TheraBand. So pretty typical, I would say, exercise plan. And again, everybody did this, no matter which group they were in. Then the group 2, the group that did not get laser, those folks did get ultrasound. Ultrasound was done with a Chattanooga Intellect mobile ultrasound device, 1.5 watts per centimeter for 10 minutes to the back of the neck and then the periscapular area, the area around the shoulder blades. Ultrasound used 1 to 3 megahertz, and they used gel as you're supposed to do. Now, if you're not super familiar with ultrasound, it's been done for like ever. So, a long time. It's been used since the 40s, I believe.
That long?
Physical therapy practice.
Interesting.
Yeah.
You don't think, I personally don't think of ultrasound as a therapy.
Right. Yeah.
And so it's not surprising, but it's interesting that it's used for that, not just looking to see what's going on.
Yes.
Because that's my limited understanding
diagnostic
of
ultrasound.
ultrasound.
Completely different. Fantastic tool in practice, whether you're, in obstetrics or musculoskeletal care. We've talked about that a number of times.
Right.
But in this case, we're talking about the therapeutic use of ultrasound, which is super common, I feel like, in physical therapy clinics. And has been for quite a while, although there's not a ton of evidence behind it. So, in this case, they say that the idea of using it is to warm the muscles, the tendons, and the other tissues to improve blood flow and accelerate healing. The thermal effects aid in pain relief, and then the non-thermal effects are help to enhance cell repair effects on the inflammatory response. So that's how that's supposed to work.
Makes sense.
Yeah, it does. It makes sense. There's not a whole lot of evidence that it really works well beyond very short-term, kind of temporary relief.
And sorry.
No.
Probably doesn't do the repair.
We don't really know. There's not a lot of studies on exactly how it stimulates repair. There is the idea that it should stimulate some level of repair. But is it really clinically significant? I don't know if that's been settled. But
well,
that's a little bit outside of my... Yeah, we should do that. The other thing that these folks got, so exercise and ultrasound, they also got TENS. So they snuck a hot pack in here as well. So 20 minutes of a hot pack with this TENS application, conventional mode, 20 minutes, 70 hertz frequency. No significant thermal effects other than comfortable warmth. Skin temperature raised an average of 2 degrees Celsius. And that was performed in order to help deliver this electric current across the skin, activating sensory nerve fibers, and then providing some level of pain relief just by interrupting pain signals. So that was what one group got. They got the exercise, they got the ultrasound, they got the TENS, they got all that. So, I mean, you're talking a solid hour of treatment there, between 30 minutes of exercise, 20 minutes at least of TENS plus hot pack, and then there's a 10-minute session of ultrasound there, so a solid hour, maybe an hour and a half by the time those patients got out of there. All right? And the other group, the group we're probably a little more interested in here, at least you and I, is the laser and exercise group. So same exact exercise program. This is all run by the same PT as well, all these groups. And the laser group, they had treatment for about 30 minutes with about 2,050 joules delivered in total using a 10.5 watt Hyro 3 device. And that's not a device that we have here in the States, at least not at this point. But it uses wavelength of 1064 nanometers, which is in that near infrared, and a low frequency between 10 and 40 hertz, and a scanning, kind of a mix of scanning over the tissues and then doing short holds as well. But yeah, about 30 minutes to deliver 2,000 joules, which, depending on the laser you've got, that's pretty lengthy.
I was going to say, that seems fairly long with my experience.
Yeah. Typically we'll deliver about 2,000 joules in 4 minutes. So it depends on the intensities, depends on your strategy. There's nothing wrong with taking more time. It just does concern me that maybe the intensity is a little bit on the lower side. But we should look at the results, right?
Yeah.
Again, laser was performed so that you could rapidly induce photothermic and photochemical effects in the deep tissue to stimulate collagen production, increase blood flow, and cellular metabolism, and remove painful stimuli. So they looked at doing this. They did these treatments twice a week, 6 weeks, and they brought everybody back at the 10-week mark and evaluated. And what they found, drum roll please. They said the most important finding of this randomized controlled trial was that high-intensity laser therapy combined with exercise is effective in increasing cervical range of motion and in decreasing the VAS, pain, and neck disability index scores at 4 weeks follow-up after 12 therapy sessions. So it improved all three of their outcome measures, not only the disability score, but the pain level and the range of motion as well. They do say, similarly, there was an increase of all parameters in the group of patients treated with ultrasound and TENS and exercise. But when you compare the results of the high-intensity laser therapy group to those of the ultrasound TENS group, statistically superior results in terms of functional improvement were observed in the high-intensity laser cohort. So they say the laser therapy group showed a significant improvement in neck function compared to the to Group B with the ultrasound and TENS. Better results than Group B. Same thing with the VAS, the pain levels. And then looking at the range of motion, they say range of motion improvements were observed in Group A, was greater than that in Group B. So on all accounts, on every measurement that these folks did, high-intensity laser plus exercise was better than high-intensity laser plus ultrasound and TENS and a hot pack, which they snuck in there as well.
That was interesting.
Yeah, it is. So,
well, and the time of the treatment seemed shorter in the laser and exercise group.
Absolutely.
Because if I remember correctly, you said the other groups took approximately an hour, and the other group took approximately 30 minutes.
Well, the exercise was about 30 minutes for everybody.
Oh, gotcha.
So, still, if you think about moving between your exercises and then going on and getting set up and starting your tens, got a hot pack you got to work in there, and then tearing that down and then taking them on from there, they smear a bunch of gel on them and do their therapeutic ultrasound treatment. I mean, it's probably closer to an hour and a half.
Mm-hmm. Yeah.
Whereas the voltage laser, they did 30 minutes exercise and 30 minutes laser. That 30 minutes laser could have been cut down to 5 minutes.
It could have.
It could have. And would it have worked as well? I don't know. I'm not doing study like this at this moment. But, certainly if you're just looking at the total amount of energy and using, a high-intensity laser like these guys did, you could get it done quicker if you wanted to. Another thing that I thought was worth pointing out is that the use of the hot pack that they did does help to kind of eliminate warmth as a variable here, because a lot of times people who are more on the class 3 laser side will say, well, the class 4 laser is just heating up the tissues, and some people like heat, so they feel better. Well, in this case, they didn't actually heat the tissues up very much. Matter of fact, they said, see if I can find it here. They said in the folks that were getting 10s, they had that temperature increase of about 2 degrees Celsius. But they say the thermal effects of the high-intensity laser were not significant. So, actually used a little more warmth on the non-laser treatment than the actual laser treatment. So to say that the warmth was the only factor here, I mean, I think that's a bit taken care of by kind of the way they did this. It's kind of interesting.
It is.
So certainly worth looking at laser therapy as an adjunct to add in to your exercise plans, especially if you have patients who are hesitant to do exercise, or they really hold back. They're afraid to kind of get into it, or they don't want to do it at home because it hurts or whatever. If they know that they can get good, quick relief with laser therapy, that's something you should be doing. And if it works better than ultrasound and TENS, and ultrasound and TENS is something you use in your practice, you should probably be using something that's a little more effective, like laser. Not to say that ultrasound and TENS doesn't have good benefits. In this case, it seems to have had.
Right.
But laser's better on range of motion, it's better on function, it's better on pain, and that's after just a handful of sessions, really just 12 sessions, and a month of no treatment.
Well, and the pain of the patient is, the utmost importance, but it also makes a clinic more efficient.
Yeah. Oh, definitely.
So.
Yeah. Having to manage several different devices and heat packs and move people from one place to another versus just getting some laser in there and letting the patient get them out the door and still have that very, very good benefit. That's a really great thing to be able to do when it comes to the logistics of running practice.
Right.
Yeah.
Right.
Yeah, for sure. The other thing to throw in there too is, yes, you can use your assistants, your like PTAs and things, your chiropractic assistants, whatever, to help set up the TENS and ultrasound. Sure, yeah, you can do that. You can do the same thing for laser. An assistant in most states can run laser for you. So that makes it even more efficient when you can help when you let your staff do some of these treatments.
Right.
And when they're trained.
When they're trained. I was going to say, the training's got to be there.
Yes, they need to be trained and be certified to actually perform that treatment, make sure it's okay with your state. But that makes it a heck of a lot easier on you as a practitioner when you can just hand them off and have that done and know that the patient's going to get better.
And it's a win for your patient.
Yeah, absolutely.
So.
There were no side effects with any of these therapies, so I think we can say we know that all those are very safe. Everything from guided exercise to TENS to ultrasound to laser.
Very non-invasive. No chemical interactions whatsoever.
Yeah, no medication issues, nothing like that. So I'm not saying to drop your TENS. I'm not saying to never ultrasound anyone. Keep doing it. It is helpful. I'm just saying you probably should be doing laser too.
Why not?
Why not? Yeah, works well. You do, of course, need to know what you're doing. Just like you said at the beginning, Christy, you can't just start exercising blindly and hoping that you feel better. So, guided exercise is good. Same thing goes with ultrasound. Same thing goes with TENS. You know what you're doing.
Right.
Same thing goes with laser. Between the different types of lasers that are out there, the different devices, the different settings, the treatment techniques. Like I said, in this case, these guys took half an hour to deliver just a little bit of laser. In some cases, you might want to do that. In some cases, you might want to do it quicker.
Right.
We've got a unit here right now that can do 2,000 joules in about a minute. So
and be very effective.
Very effective. So you just need to know what you're doing. You have the training, you know what you're doing. We can do that for you. Laser Therapy Institute was designed and created to help healthcare practitioners like yourself know what you're doing with laser. We've got the settings, we've got the protocols, and like I said at the beginning, we've got a new spine course. If you are very interested in working on the spine, or maybe your license limits you to working on just the spine, or that's just kind of your zone where you like to be and that's what you want to know about, this is a great course. We'll talk about a lot of the common spine conditions you'll find. We'll give you the settings to be able to help with those, the protocols, how often do I treat, how long are the treatments, what settings do I use, what else do I need to be worried about. This is a great course for all that. And of course, if you want to know more than just spine, you can get a full membership to LTI. Full membership to LTI includes all of our custom settings, all of the protocols, not only spine, but also sports med, also neuropathy, the whole bit. And that is all you'll ever need to know about laser.
Right. And we keep we keep enhancing and adding more and more content.
Yeah. We're always adding stuff. We're always revamping and
improving. There's nothing wrong with improving what's already been done.
Right. Yeah. We have
keep it current.
Some versions of our courses that have been around for a few years now that Christy's already been on top of, kind of reworking to modernize them, just not sitting still on it. And we have studies that come out all the time, like this one, that we need to learn from, and that is where LTI's protocols are built. Is from the research in combination with what we see in clinic. Not only myself, but everyone else who is a member of LTI helps to contribute to that project.
So, want to stay on the cutting edge.
Got to stay on the cutting edge.
Non-invasively, of course.
Non-invasively, the non-cutting edge. All right.
Sorry.
Thank you very much for joining us today. Christy, thank you very much for being here. It's always lovely to have you here.
It's always a pleasure to be here.
We'll be back next week with an episode of Healing at the Speed of Light for patients.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.